Good afternoon. I'm Andrew Armstrong. I'm a professor of medicine at Duke University and a medical oncologist. Today I presented the ARCHES trial, a phase 3 global randomized study of men with metastatic hormone-sensitive prostate cancer. In this trial, we enrolled 1,150 men and randomized these men to enzalutamide with androgen deprivation therapy or androgen deprivation therapy alone. In this trial, the primary endpoint was called radiographic progression-free survival. That's the time that a patient has until there's imaging progression of metastatic disease or death. This trial met its primary endpoint and demonstrated a statistically and clinically meaningful improvement of about 60% in the risk of progression or death over time. One of the most important takeaway messages from this trial is that important subgroups demonstrated benefits. Notably, those men who had already had docetaxel, that was about 18% of the men, demonstrated a 50% improvement in the risk of progression or death after the completion of docetaxel with enzalutamide. And another important subgroup, the patients with low volume disease, that's oligometastatic prostate cancer, had a significant improvement of about 70% in the risk of progression over time. Other secondary endpoints we saw were improved, statistically and clinically meaningfully delays in castration resistance, PSA progression, and the time to next therapy, which was typically docetaxel or abiraterone in this global study. Enzalutamide was well tolerated. Most of these men remained asymptomatic with a very high level of quality of life over time. We did see some side effects as expected with enzalutamide, such as fatigue, high blood pressure, slightly higher risk of falls, emphasizing the importance of blood pressure monitoring and exercise for these elderly men. But very well tolerated. Most of these adverse events were grade 1 and 2, and the grade 3 and higher side effects did not differ with placebo, and most men tolerated this over a fairly long period of time. In conclusion, ARCHES was a positive phase 3 study establishing enzalutamide as an effective option for men regardless of disease pattern of spread, disease burden, and the receipt of prior docetaxel, offering a new option for men with hormone-sensitive prostate cancer. Thank you.